So good morning to the dignitaries on the dais, off the dais, faculty members and parents and our prospective students. So we are very happy at Saveetha Medical College to invite the batch of 2025, and so I would like to actually walk you through, what your journey is and what is our philosophy as an institution, and to also realize, why Saveetha also stands tall in national and international rankings. So to start with, the thing we want you to remember is that wise minds steer towards the horizon whilst others stay anchored to the present. So the institution is steered towards the horizon of greatness. I can with great assurance tell you that definitely we will become one of the best institutions in the world, if not the country, in the next decade. So that is our vision and that is our direction. And we are very, very steadfast in that vision, and we will explain as to why and how we are going in that direction. And we also congratulate you for choosing an institution that is going to be the leader rather than just going by the present today. So if you progressively look at our NIRF rankings, we had in the last 3 to 4 years, we have been progressively increasing. So from the rank of 25 to the rank of 11. Currently, we are the third best ranked institution, the second best medical college in Tamil Nadu after CMC Vellore. And that is something which we are very proud of. So there are 3 domains at which we focus our innovation in. One is in academics, research and clinics, and the culmination of these 3 are the reasons why we also are able to succeed. And ultimately you need to realize that, as an institution succeeds, it also banks on the success of the students. So tomorrow if you say you're from Harvard, that itself carries half the weightage of what you have achieved. And ultimately the growth of the institution is your personal growth, and your personal growth is the growth of the institution. So that is how things work. So one of the main things which was a unique factor at Saveetha compared to other institutions, that we were dedicated in small group learning, and till last year we were doing it with 40 students a batch. So that means we have split into 6 batches to reteach everything 6 times. That itself is a remarkable uptake, because many institutions still take classes at 250 people in a single classroom. You can only imagine the kind of attention, maybe a few students in the front may get the attention they want, but there may be a student who's not able to follow, but they may not even be able to speak up because the group is so large. They might not be comfortable doing it. But this year we are taking it one level higher, and we are taking it to we are dividing into 12 batches and bringing it to 22 to 25 students per batch. No other institution in India offers such a level of small group learning. I don't think schools even offer this level of personalized care, and that is one of our USPs. So the next factor we focus on is a factor of spaced learning or spaced relearning. So how this works is, we would cover our portions in a span of 5 to 6 months and 4 to 5 months, and then we would again recover the portions at 2 cycles. And the reason is that if you learn and then you have some space to read about it, or space to percolate it and then again reread it, the long-term memory is much more plastically entered into the brain. Because once you read, or if the portion is taken till the end of the year, usually whatever is taken towards the end, the students do not have time to become thorough with it. So there are a lot of studies which we have also done, and we also have cited here, which shows a metacognitive awareness and also spaced education and how it helps in learning. So this is one of the primary reasons we are also able to see very good results from our students because of this kind of teaching method. So the next thing we focus on is we do concept maps, and this is to give a bird's eye view of the topic, because learning is much easier if you first learn a little bit about everything and then go in depth. Knowing everything about everything is not possible, and I don't think you need to be that ambitious. But you need to at least know the boundaries of where the knowledge expands. And for that, concept maps are the best method. Almost all our teaching methods are through concept maps, and they are integrated in your exams as well. And we also have integrated modules where if we take the renal system, for example, a urologist and a nephrologist come and take the first year classes, which is also special in the sense I have not heard of many institutions where a super specialist come and take classes for the first year undergrad. So the next area is, all this is translated to better results, as you can see in the graph here, and I would like to focus on R&D. So in 23-24, we were the second largest research publishing institute, publishing close to 2,500 medical publications, and of which we also had the second highest number of Q1 papers, which are the high quality papers which are in the top 25% of the journals. And we were second to AIIMS Delhi. And I'm very happy to announce that this year, that is 24-25, as you can see in the Skywell benchmarks, this is a public domain. You can see that Saveetha is 5,741 publications, surpassing AIIMS, which has 4,800 papers. Our citation count is also proportionally higher, and publications in Q1, we have 1,600 papers, whereas compared to AIIMS, which has 1,300 papers. You can see that, medical research itself is not a domain that's very popular. Even top ranking institutions do not have that many papers. And to create a culture of research and to bring that into our undergrad, to make a vision of the NEP to become a possibility, these are things that we have been it requires a lot of hard work and commitment. It also requires a lot of focus. And that way we are very proud of what we have achieved. And it also gives you an advanced bird's eye view that definitely next year I'll be publishing with much higher numbers, with much higher output. And that's how we roll. So I've already shown the data here. So last year we had 72 top 2% scientists. We were one of the highest in the country. I think we were 6th or 7th position. And this year we surpassed that with 111, and we recently found out it's actually 112. We are second only to IISc Bengaluru, which has 118 top 2% scientists. So it also shows that the rich exposure you get here, you get a lot of very bright minds and researchers available at your disposal. And collaboration and innovation is what a university can offer to the society. The difference between a college and a university is that a college will give you training, like training to do A, B, C skills. Whereas a university is one that inculcates knowledge, it creates knowledge. And ultimately, for the growth of the society or the upfront of the humanity, you need to have the next generation people thinking about the future and creating better methods to improve healthcare or any other respective positions. So in that way, Saveetha is well positioned and most strongly positioned with the best amount of talent when it comes to research and output. So we also have one of the world's largest medical research summit where we publish around 4,500 posters. Most national conferences would have only 1,000 posters, give or take. All of this has to be unique. All of this is vetted. All of this is evaluated, peer evaluated. And students from all colleges come and see at all the kind of work done by our students. Next is clinical training. So integrated clinics is one of something that's very unique to Saveetha again. Usually in a clinical setting, it would be examination done by a doctor or the doctor explaining a case to the student. But that is more of passive learning. In this case, what we do differently is that all basic diagnosis and triage is done by the undergrad student, and they themselves develop a spirit of intuition, in the sense as you keep seeing more and more patients, you see 10 times more patients than normally you would see. And there's a common saying, a rare disease is rare, and that's because you will not be frequently doing it. And as a fresher, you would immediately start suspecting for the most rare disease when you see the patient. But with experience, as you keep seeing, you will start seeing trends, you will see patterns. These are things you cannot teach from the textbook, but only through experience-based learning. And that way, having the ability to have holistic learning, and also to develop the sense of intuition, to develop clinical acumen, to make diagnosis, which will later be corroborated with the faculty. You should be able to articulate your diagnosis, defend why you think this is a diagnosis, and also suggest therapy. And that is the most real life, closely mimicking scenario to a private practice. And that is next is our MIAS system, which is a medical information archival system. It's our indigenously developed software done here at Saveetha by our own engineering division. And what makes MIAS unique is that most EHRs would be medical records or NABH focused. They are focused on hospital accreditation and hospital records at a clerical aspect. Whereas MIAS works in a completely different way. It's completely academically focused. It focuses primarily on the students' examination of patients and the grading of the same examination done by faculty. That is the main engine running MIAS, whereas the other academic hospital records, all those things are there at the background. So automatically it's designed for an EPA, and an EPA is nothing but an entrustable professional activity. In medical education, you would, an EPA is one where you train the student to perform certain procedures at a distance monitoring. And only NMC is talking about bringing EPAs into medical education by the 30s or by 2035. We are already implemented EPAs across our entire curriculum, and all our graduates and postgraduates are having very clearly defined EPAs to graduate and also attain competency. And I think, see, there will always be a scenario where, you're training a group of students and 2 or 3 students really pick it up well, no matter how you teach. And then some of them are lost in translation. But when you keep systems like this, no student can graduate without the competency. That means it makes sure that every student is trained properly to see, examine, diagnose, and treat a patient. And that goes a long way, because once your subject is very strong and your acumen is very strong, there is never a reason for you to stoop to unethical practices, because you know to do it the right way. And that is one of the main reasons we focus on teaching you how to make a successful practice, but with the right tools. We also having, as Vice Chancellor was also talking to the chief guest, that we give around 5,000 to each of the patients who get admitted here, and that's why we have one of the strongest IP and OP services in the hospital, and this is continuously growing. Our ambition is to become one day like Safdarjung, which treats around 12,000 plus patients, and that would be our vision, to bring in complete excellence, because we want to bring in a system where every student has so many patients that when they graduate they have so much of experience. This is a photograph of our ICU. It shows how thoughtfully designed it is, because ultimately 50% of the healing comes with the ambience and how the patient feels about themselves, and goes a long way into the psychological aspects of healing. So this is a Sprout Infertility Center. So all of these facilities, these are all for free patients. It's not the corporate division or anything. And this kind of investment or this thing most institutions would not be doing, and that is why Saveetha stands tall. So this is a small testimonial.
Currently in my 3rd year, our small group learning system encourages active participation. We are divided into smaller batches, allowing for more personalized attention and deeper discussions. In smaller groups, it is easier for everybody to ask their doubts and clarify them, making interactive more effective. During exams, examiners from central institutions like AIMS have praised our performance and compared their performance to our own students, praising the impact of their teaching methodologies.
I had the opportunity to come to Saveetha Medical College for MBBS practical exams, and I was very impressed with the quality of teaching and the examinations which were conducted in a very fair and transparent manner. The students performed well, and I would like to compliment the teaching faculty and all the members of the staff for the biochemistry department to keep up the good work.
Hello, I am Dr. Suchanda Sahu. I work as additional professor in AIMS, Bhubaneswar. This is the first time I have come as an examiner to Saveetha Medical College, and it was a nice experience. The campus and the discipline The maintenance of the labs and the lecture theatres were very impressive. The students have done very well in the theory exam, and it was amazing to know that they are able to read and interpret articles, and they also have an evaluation in the theory paper.
Hello, I am Dr. Kunga Patra from PJME Chandigarh, and coming from a postgraduate.
So basically what we have been doing in the past 3-4 years is almost all our examiners are from central institutes. So 90% of the examiners are from one of the AIMS or PJ institutions. And the reason we do that is you need to put yourself to a stronger evaluation to make sure that you really know where you stand. And mostly we have been getting very positive responses because they say that our students are able to perform equivalent to their students. And mind it that what kind of students enter AIMS, that very well. You need to be in the top 5,000 ranks nationally to get in there. So it is really happy and heartwarming to see that our students with our newer training methods we are able to uplift our students and make them have a better future. So with those few words, I welcome you all to Saveetha Medical College. There is a huge and a rich journey available. You as a student, the only thing we ask of you is that use every opportunity available, be a sponge that can absorb as much as it can, because every day you come here is valuable, and you need to be very smart in making sure that you have a strong goal. You want to be successful in life, you want to be the best at whatever you do, you want to be known and respected by your peers at your society, you want to be respected by your peers in your own class. For all those things put together, you need to be very, very clever and smart in making sure that you build your portfolio from today. You attend as many programs as you can. You try to, can you just reduce the mic a little? Attend as many programs as you can. You can, it's echoing. Attend as many programs as you can. Build up a very rich portfolio. You should have plenty of certifications. Make sure that today itself you decide what kind of a central institute you want to go for post-graduation, because that is our ultimate goal. We want you to be successful and go up in life, and also ultimately become, like your chief guest here, somebody who makes a huge impact in your society and brings name and fame to your family. So those few words, thank you and have a wonderful day.
Thank you, sir, for your enduring support for education and innovation. We are honored